Hi, everybody, from the Art of Listening to Your Body. I hope you're enjoying your training course. My name is Zahava. I'm an acupuncturist in Chicago, Illinois, and I have a women's health practice here where we treat all sorts of things, helping women transition through all their life stages, whether that's puberty, through fertility, through menopause. So we're really just here to help support people. But I'm really honored to be teaching you guys a little bit about tongue diagnosis because this is a really big concept in Chinese medicine, and it's one of our many diagnostic tools we use to help give somebody a Chinese medical diagnosis. The whole idea is that with our tongue, it's the only external muscle our body can see. So it's a way, whenever you have something coming from the inside of your body outward, like for example, when you go to the bathroom, you can use that to say, like, wow, I'm really dehydrated, or, I have digestion issues. So the tongue is another example of that, where it's something internal, but when we express it outwards, we can see what's going on inside of our bodies. Now, a normal tongue looks like it's like slightly red, slightly like a pinkish red with a very thin white coat. And it's usually a nice shape without a lot of cracks. So there's a few different things that we look for when we look at somebody's tongue. And again, I just want to kind of reiterate that this is only one piece to a puzzle. So when I look at all of your tongues right now, it's literally just based off of this only piece of tongue diagnosis. Typically, we would do a major intake, and we'd also check your pulses, and we do other things as well to really come up with it. So this is really based off of just the pictures I got without knowing any of you. But I think you'll still learn a lot from doing this. So in a typical tongue diagnosis, we're looking for what's the color of the tongue body itself. Is it red, purple, blue? What's the what's the color of the coating on top? So is it whitish? Is it yellowish? Is the coating thick? Is the coating thin? Is there a lack of coating? What's the shape of the tongue? Is it big and swollen? Is it very long and thin? Are there any cracks? Are they vertical cracks, or are they horizontal cracks? So that's going to tell us something. What's the overall size of the tongue? Generally, in a small person, we'll see like a smaller tongue, but sometimes a more petite person will stick out their tongue and you're like, wow, that doesn't match their body. So there's like a lot of water retention or swelling in the tongue. And then we look at how does the tongue move. So is it tremoring or shaking or deviating towards one side? And then we'll do the moisture. Is it dry? Is it wet? Does it look greasy? And so all of these things create a picture of your internal health. And so often we'll use it to like basically confirm the diagnosis we're already thinking. So we'll have someone stick out their tongue at the end of an intake to be like, wow, yes, there is a lot of stagnation. Things we can't see in the pictures is your sublingual vein. So underneath, sometimes people will have thick distended veins, and it could be like a purplish or a bluish, and that's also going to tell us information. So a good example is often before a woman menstruates, she'll have thick, fuller veins underneath the tongue. So we can tell that. And sometimes when you're on certain medications, that will also change the tongue color. So for example, like steroids will make your tongue look different. If somebody takes a lot of like stomach acid kind of meds, like Pepto-Bismol even, it makes your tongue a little brownish. A lot of coffee will also make your tongue more yellow. So depending on what they ate. We also tell our patients don't brush your tongue because that will also like ruin our diagnosis a bit. So there's a ton of factors. And then also based on the pictures I'm getting, the tongue might look different in different lighting. So I'm just like mentioning all of the different factors that can be. But I'm going to share my screen with you now and pull up the tongues that I've received. And we'll go person by person, kind of like what my analysis is and why. Just to mention before we start, the tongue we divide into three sections. So in Chinese medicine, we call these the three jiaos, or in English, that's like the triple burner. So you have an upper burner, a middle, and a lower. Your upper burner houses your heart and your lungs. The middle burner is your spleen and stomach. And then the lower burner is like uterus, intestines, kidneys. And so the tongue we divide in three sections as well. So there's going to be the tip, the middle, and the back of the tongue. And the tip is the upper jiao. The middle of the tongue is the middle, so usually digestion. And then the lower burner is like, yeah, your kidneys, intestinal things, and that's going to be all the way in the back of the tongue. So based on those three sections, we'll diagnose, and also your sides of the tongues are your liver and gallbladder. So we'll see different variations in just this picture. So let me share my screen with you. Hold on. I just have to figure out. Here we go. Okay, so your beautiful tongues, are you ready for your tongue diagnosis? Okay, Ivan, I'm guessing that's how I pronounced your name, and I'm sorry if I'm botching that, but you actually have a really good looking tongue, I have to say. Really nice coloring. It's like slightly like that reddish pinkish, and you have a great example of the thin white coat that we really like to see. The things that I think I would kind of question about is if you notice the sides of your tongues there's kind of slight ridges, not bad, but there's no coating on the sides of the tongue. And then if you notice in the middle, you have a little bit of a vertical crack, and that's showing and it's very shallow. So the deeper something is, that means the more internal and deeper it is in the body. So when it's shallow like this, it's like the start of something happening in digestion. So it's like a slightly what we call like spleen Qi deficiency. So kind of starting to show something's maybe brewing, but easily fixable. And then you have little red dots along the right side. And I think that there's if you see here, there's like little red dots on the right side more than on the left side. And that's showing like you have some ascending liver yang, we call it. So, this can manifest in multiple ways, but, something like, maybe some anger, irritation, headaches, something like that, where your liver yang is starting to show some heat. But overall, it's like actually a really, really good example of what a tongue should look like. So I'm glad that you were the first picture. Okay, Theodora. So you're a perfect example of a spleen Qi deficient tongue. There's a few of these here. And again, this is a very common pattern, especially for those of us living in the Western world. So your tongue is pale, very pale, and it's swollen. And you can see on the sides, there's these teeth marks as if the teeth have been, it's hard to talk about tongues because my tongue gets twisted. As if your tongue is pushing up against the sides and causing those teeth marks. Something interesting, and you also have that nice little crack here, again, like a shallow crack, but showing there's some fatigue in digestion. So if I saw you, I wouldn't be surprised if you had like, slightly low energy, like low appetite, some fatigue I'd expect that. The spleen in Chinese medicine holds our qi up. And so in the center of the tongue, the spleen is supposed to hold everything in. And when the spleen is deficient and not doing its job, it doesn't hold in the middle. So that's why the sides of your tongue start to loosen and you get some water retention and it starts to spread into the teeth. So you also have, if you notice, your crack is a little bit longer going from the middle jiao all the way to the upper jiao. So that's showing some spleen and stomach deficiency. And it's a little bit on the verge that can lead to something worse, like what we call is yin deficiency. So we'll use the tongue to kind of show a prognosis too, like where are you leading in your life, and and how serious is something. So it's a shallow crack, but definitely some weakness in digestion and a little bit of weakness up here, showing it's a little bit redder at the tip, so showing a little bit of heart heat. Shannon, okay, you're a great example of a damp tongue. So in Chinese medicine, our medical jargon's kind of strange because we base things off of nature. And so 2,000 years ago when they were developing the medicine, they would look at people and say, wow, this person's dry, this person's hot, this person's damp, this person's cold. And so this tongue is damp. And honestly, most Western tongues have dampness, especially it depends on the climate you live in. Like here in Chicago, we're by the Great Lakes, and so there's a lot of wetness and dampness, so people get a lot of like headaches and a lot of like colds and damp signs and symptoms. Your tongue, again, just based on the picture, looks has like a greasy coating, like the quality is a little greasy, so that shows internal dampness. So I would say, okay, avoid dairy and things like that. And you have, again, some of the teeth marks too, so that's the dampness. And you almost like don't have a coat on your tongue. So this can, and yeah, and you have like slight cracks too. So the lack of coating is usually when there's long standing like qi and blood deficiency, and then you don't have that nice coat on your tongue. Um, so I would say, we can definitely help this with just like diet and lifestyle recommendations for sure. Sarah, you have a pale and dry tongue. The first thing I see is, wow, this looks dry. There's not a lot of moisture. And you have those little horizontal cracks in the center. And so that's a yin deficiency. So in Chinese medicine, there's yin and there's yang. And yin is our fluids. And so definitely it's showing there's like some deeper deficiencies, especially like in your middle jiao, because that's mostly where those are. And you have, if you notice, your whole tongue is pale, and then at the tip, it's pretty red. So that's heart heat, anxiety. It's usually anxiety or insomnia when you have like such a red tip compared to the rest of the body. It also looks overall like your tongue has like a cold quality to it. So if you told me that you run cold, I wouldn't be surprised. And Nina's a good example of this, because Nina, look how white her tongue coat is. So it's because the tongue coat is thicker on Nina, so it's more phlegm. So it's like a more substantial type of dampness. And the coat's so white, so it's like a phlegm, damp coldness there. And so we'll say drink some ginger tea will help keep you nice and warm. So Nina, you have a more of a swollen tongue with the teeth marks, so that's the dampness. And what's really interesting is you have this little red dot. So I didn't know if this was the picture or you actually have this red dot, but if you have the red dot, that's showing stagnation, like there's some sort of blood stasis in the body. And this can be in multiple areas. Like if you had a stomach ulcer, it could look like this, where you have like that red dot. Or if you have something like, endometriosis or something, some sort of blood stagnation, it can show here in the tongue, even just by that little dot. But it's definitely, we consider that like a heat toxin is what we would call it. And you have a really nice deep center crack right in the middle. So just that's more of like a stomach qi deficiency. Someone's calling me, sorry. So a little bit of stomach qi deficiency too. So I think we really need to work on digestion. And Nina, I love your shape. It's actually interesting. If you notice, your tip is flat on the bottom. And so that's showing there's something, in the spleen, stomach, kidney area, some sort of deficiency. I would ask you, do you have IBS? How's your digestion? That's kind of where I would go. Possible, what we call food stagnation. So for me, definitely, I would go start asking a lot of questions about digestion. Okay, moving on. Louie, you have a redder tongue, so a break from all these pale tongues. So overall, it's showing a little bit, it looks like there's a little bit of heat in your tongue. So white is cold and red is heat. But you also have almost no coating, or it's like very thin. But it looks like there's no coat that I'd be able to kind of scrape off. So that's usually stomach qi deficiency. And it's much redder in the center, so stomach heat. So I'd ask you, are you hungry a lot? That's usually a good sign of stomach heat. It's almost like, I don't even know if it's hard to tell just in a picture, but it's like slightly purplish. So just, again, some stasis. When there's purple, that's blood stagnation. And in the back, it looks like you have this long, like horizontal crack. And because it's located in the back, then we know, okay, that's a kidney yin deficiency typically. So it looks like drier in the back and moister in the front. So they're showing a disconnect between your upper jiao and your lower jiao, and there's something not connecting. So we would do kind of acupuncture points with you to help kind of regulate your triple burner. Gemma, okay. Gemma, you're a classic spleen chi deficient tongue, kind of like Theodora, where it's damp and it's pale. And if you notice, it's interesting. So it's definitely spleen chi deficiency, but in the upper jaw, it's redder and swollen, like at the tip. And so I'd kind of go, oh, there's maybe some lung heat. Are there allergies there? Any respiratory things going on, any like inflammation up here, or just overall anxiety. But overall, this looks like there's deficiency. So again, if you were kind of tired, fatigued, had loose stool, poor digestion, I wouldn't be surprised. You could totally not have that stuff, but those are the questions I would ask just based on your tongue. Emily, um, I'm happy that you have this tongue here because this is a good example of blood deficiency. So Qi deficiency and blood deficiency are different, but Qi and blood always go together. So your tongue looks dry, Emily, and swollen, and the middle's sunken in more than the rest. So that's a very spleen Qi deficiency when there's like a sinking down in the middle, some sort of like middle jiao deficiency. But overall, it does look like there might be some blood deficiency. And let's see. Oh, and the sides are redder. So when both sides are redder, that's like liver qi stagnation. So that's a classic stress diagnosis. And there's some little slight cracking in the center too. So something there. Christina, so pale and dry tongue also. So pale and dry tongues are blood deficient tongues. There's some swelling, so a little bit of dampness, but you have not the swelling is actually not bad. What's interesting about your swelling is the right side looks more swollen than the left side. So possibly some qi stagnation somewhere where there's like not movement if your right and left aren't matching well. But you have a lot of these little cracks. So the center crack and then little yin horizontal cracks coming off of it. So it's kind of the start of a stomach qi deficiency and some yin deficiency. So a good example of yin deficiency is menopausal women when they're getting, they'll have like a redder tongue with little horizontal yin deficiency cracks. So they'll have hot flashes and night sweats. So you definitely are showing like the start of it, and the cracks aren't so deep or anything, but it would make me, say, okay, let's get you in for treatment pretty much. And what's cool is, Christina, your tongue is heart-shaped a little bit, so there's an indent, and that's showing some heart qi deficiency too. Ariana, okay, you guys have good tongues. Yours is that long, deep center crack. That's like the thing that is coming straight out at us. When I see this, when there's a crack that's going from the back all the way towards the tip, we ask about the psycho-emotional. Is there trauma in your past? Anything? It's deep. It's usually when a crack is that deep and that long, it's usually something that we would ask a lot of questions about. Like just trauma, emotions, stress, things like that. Your coat's pretty thin and wet on both sides and some swelling. So again, there's definitely dampness here. That's what sticks out. Alexandra, so this also is kind of a qi and blood deficient tongue. First, it looks kind of short and it has that sunken middle, as well as just overall swelling and just paleness. So this is another example of the spleen qi deficiency. And you have a redder tip with like little dots, so some heart heat and stress. But definitely, if you look in the back, there's a lot of puffiness there. So some dampness in the lower jiao, I would say. So it can look like the dampness in the lower jiao could be like excess discharge, chronic yeast infections. It could be a lot of different things. It's definitely like, if you notice, just like puffy up front, puffy in the back, and the deep, a deep groove in the middle. Phoebe, I have two pictures for you, one here and one I noticed here. They're two different tongues. So for the first one, let's see, hold on. Oh, the first one, it's not great lighting, I can tell, but you have a lot of like little kidney deficiency with some heat. It looks like little cracks. It looks kind of dry, and you have that long crack going from the back to the center again. So I would say this is a crack with some kidney stuff going on. And the second Phoebe picture is totally different. And I don't even know if this is, I don't think it's the same person because the tongue is so different. But in this picture, it's like pretty purplish. So there's a few things that stick out to me here. There's like a purple tongue body. So that's blood stasis with internal heat. So is this person in pain, or have they had a lot of pain in their lives? The, it's a heart-shaped tip, again, with that little groove. So heart deficiency, heart heat, anxiety, psycho-emotional things. And again, with that hammer, it's almost like that hammer shape we say, where there's a flatness to the tip. So that's like, it could be stomach, spleen, or kidney deficiency. And the sides are pretty jagged too. And there's a thicker white coating in the back. So some coldness in the lower jowl. So this also is an example of like the upper jowl not meeting the lower jowl. So just really interesting finding. So you guys gave me some really good homework to help rev up my knowledge on tongue diagnosis. And this was so much fun, but I'm so happy to answer any questions you might have. You can follow me on at the Chi of Z, and feel free to email me or contact me if you want to learn more about your tongue. But I hope you enjoyed this, and I hope you enjoyed your class. Have a great day, everyone. Bye.